Today we will study about hypertension. Definition of hypertension. Hypertension is also known as high blood pressure is a long-term medical condition in which the blood pressure in the arteries is persistently evaluated. The systolic blood pressure will be more than or equal to 140 mm of Hg and diastolic blood pressure will be more than or equal to 90 mm of Hg. Types of hypertension. Prehypertension. In this condition, systolic blood pressure will be 120 to 139 mm of Hg and diastolic blood pressure will be 80 to 89 mm of Hg. Hypertensive stage 1. In this condition, systolic blood pressure will be 140 to 159 mm of Hg and diastolic blood pressure will be 90 to 99 mm of Hg. Hypertensive stage 3. In these conditions, systolic blood pressure will be more than or equal to 160 mm of Hg or diastolic blood pressure will be more than or equal to 100 mm of Hg. Pregnancy induced hypertension. In this condition, because of increased blood production of hormones and enzymes during pregnancy. Etiology of hypertension. Primary hypertension. It is the evaluation of BP without any identified cause. Secondary hypertension. It is the evaluation in the BP with an exact cause. This type is account for 5 to 10% of total cases. The cause of secondary hypertension includes congenital narrowing of aorta, renal disease, endocrine disorders like Cushing's syndrome, neurological disorders like brain tumor and head injury, sleep apnea, medications like oral contraceptive pills, non-steroidal anti-inflammatory drugs, and cocaine, cirrhosis of liver. Risk factors. Age. Change of cardiovascular diseases after 50 years of age, alcohol, smoking, and diabetic mellitus, excessive dietary intake of sodium, gender, family history, obesity, sedentary lifestyle, stress. Pathophysiology of the hypertension. The normal blood pressure is maintained by four mechanisms: sympathetic nervous system activities, activities of vascular endothelium, activities of renal system, activities of endocrine system. Sympathetic nervous system activities. When the BP is decreased, the activation of a central nerve system will occur. The increased central nerve system activities increases the heart rate and cardiac contraction. The increase in the heart rate and cardiac contraction produce vasoconstriction in the peripheral arterioles and promotes the release of renin from the kidney. The net effect of central nerve system activation is to increase the arterial blood pressure by increasing cardiac output and systemic vascular resistance. Activities of vascular endothelium. The vascular endothelium is a single cell layer that lines the blood vessel. It will produce vasoactive substances and growth factors like nitric acid, endothelium, etc. These substances are potent vasoconstrictors and causes increased blood pressure level. Activities of endocrine system. When the angiotensin 2 is stimulated in the adrenal cortex, it will secrete aldosterone. The aldosterone will stimulate the kidney to retain sodium and water. Thus, the BP and the cardiac output will get increased. Clinical features. Sometimes the high blood pressure does not cause any symptom, so that it is known as silent killer disease. In some patients, the symptoms may develop like severe headache, blurred vision, dizziness, nausea, vomiting, fatigue, confused chest pain, shortness of breath, irregular heartbeat, palpitedema. Diagnostic evaluations. History collection, physical examination, medical history of diabetic mellitus, complete blood count, chest x-ray, ECG, etc. Management. Mainly the management of hypertension is possible by two ways, which include lifestyle modification, pharmacological therapy. Lifestyle modification. The lifestyle modification measures mainly includes weight reduction, DASH diet, Dietary approaches to stop hypertension: dietary sodium reduction, reduced alcohol, exercise, and stress management. Non-pharmacological management means lifestyle modification. Mainly, it includes maintaining a healthy weight, reduction of salt or sodium intake, increased physical activity, tobacco and smoking cessation, limit alcohol consumption, limit fat intake, control diabetics. Pharmacological therapy. Various groups of drugs are used for the treatment of hypertension. Collectively, these drugs are called as antihypertensive drugs, which includes diuretics. It helps the kidney to reinhibit the sodium reabsorption in the distal convolutory tubes, ascending limbs, and a loop of Henle. Chlorothiazoids and fusamides. Beta blockers. These medications reduces the workload of the heart and blood vessels and causing the heart to beat slowly and with less force. Example, atenolol, propantol. Alpha blockers. These medications cause the peripheral vasodilation of the blood vessels. Example, parazone. Vasodilators. These medications acting directly on the muscles in the walls of the arteries and preventing the muscles from tightening and arteries from narrowing. Example, nitroglycerin, sodium nitrate, Prost.